I have been a doctor for over 25 years, and currently I'm the lead physician and chairman of the National Health Task Force of Zimbabwe. Our job is to identify the greatest health issues in Zimbabwe and provide the Ministry of Health with solutions and integrated action plans in order to improve health and lower the burden of disease. Currently, Zimbabwe is plagued by communicable diseases, where the top leading causes of death and dailies lost are due to HIV/AIDS, respiratory infections, and neonatal complications. Zimbabwe is also seeing an increase in non-communicable diseases, primarily malignant neoplasms and cardiovascular diseases. This situation has led to a double burden of disease, further putting a greater strain on Zimbabwe's healthcare services. It is the responsibility of our task force to ensure that these health issues don't become health crises.
Hi, I'm Dr. Robert Baratheon. When I was asked to join the Global Health Initiative, I knew that I was the right man to serve as doctor consultant. Having worked in several HIV/AIDS clinics across Zimbabwe's rural regions, I've grown to fully understand the HIV epidemic. Now, Zimbabwe, along with all African nations, have been making steady progress towards tackling the HIV/AIDS epidemic. However, if we look at Zimbabwe's current prevalence rate of 15% and the DALYs of nearly 3 million, we'll see that AIDS is still a relevant issue and must be tackled. We recommend movement towards ART treatment for rural regions and ensuring that women have access to ART and mother-to-child transmission of HIV is no longer an issue.
Diarrheal diseases are a serious health issue in Zimbabwe, primarily due to the lack of improved drinking water and improved sanitation. Since 2000, deaths and dailies lost due to diarrheal diseases have greatly increased. In 2000, it caused 5,000 deaths in the year, making up 2% of all deaths, and the number increased to 6,300 deaths in 2012, making up 4.5% of all deaths. Looking closely at the data, we see that about 55% of all deaths caused by diarrheal diseases are among children from the age group 0 to 4, killing almost as many children as HIV/AIDS a year. Diarrheal diseases are a primary reason as to why the under 5 child mortality rate is so high in Zimbabwe. In order for Zimbabwe to meet the Millennium Development Goals, Zimbabwe must take steps to improve and expand the coverage of oral rehydration therapy and other treatment options, and further improve sanitation to effectively deal with this health issue.
Hi, my name is Dr. Baljinder Bains, and I am a UNICEF representative. As an advocate for the eradication of world hunger, I can say that this task force is a viable solution to reducing malnutrition in Zimbabwe. Additionally, malnutrition is an increasing problem in Zimbabwe, as WHO reported that Zimbabwe's daily count due to nutritional deficiencies increased from 263,200 to 368,200. At the same time, Zambia, a neighboring country, was able to reduce its dailies. Moreover, malnutrition and a lack of proper food can have devastating effects on the population. In Zimbabwe, it has led to many consequences, such as the inability to work and go to school. It is estimated that malnutrition in Zimbabwe can reduce a person's lifetime earnings by 12% as a result of a person's inability to go to school. If a solution for malnutrition were successfully implemented, it would allow the country to effectively reduce nutritional deficiencies and foster growth.
Hi, my name is Avnit, Sekhon, and I've been fortunate enough to work with the Zimbabwe Health Task Force on implementing a health solution. I was brought on this task force because of my previous success in Ukraine and dealing with the health issues they faced. In Ukraine, what we had was mobile health services, whereby we went about and we went to rural villages and gave help to people that needed it the most and gave help to them in a fast and effective manner. For HIV and AIDS, we want UNICEF and WHO to take control of the drug transportation program and take control of transporting a subsidized ART and giving it to rural mothers. For malnutrition and diarrheal diseases, we need to take advantage of the high literacy rate Zimbabwe has and educate the population on this, whether that be teaching them about oral rehydration therapy, teaching them about exclusive breastfeeding, or teaching them about making more with the food they currently have. Now, we expect this plan to take place as soon as we get the approval from the government, and we expect the results to be seen within the first few weeks.